Hi, everyone. I'm Dr. Kayleen Mulvihill, and I am so excited to be presenting the first part of the Female Autonomy series. This series is all about understanding your body and your health. Today's focus is going to be on estrogen, one of the most complex and important hormones in your body. The Female Autonomy series is a collection of presentations dedicated to women's health. It is designed to empower you with the knowledge you need to fully understand your body so that you can be your biggest advocate. You can have the tools to really create a deeper connection with your body, the function of your body, and just enable you to make informed decisions and lead your most vibrant, healthy life. My mission, not only with this series, but with my business, is really truly to empower women to take ownership of their body, their health, and again, their lives. So, a little bit about myself. I'm a doctor of physical therapy. I have over 14 years in the fitness and nutrition world. And truly, this is not just my passion, but it is my life work. I focus on this because of my own journey. I struggled with PCOS, PMDD, and pelvic floor issues throughout my teenage years and in throughout my 20s. It was not until I went back to school in my late 20s as a physical therapist that I got most of my answers because I finally had and was empowered with the education to fully understand how my body was functioning. And now my goal is to instill that upon you. So I'm super excited to be diving into this first part, understanding estrogen. We are going to discuss the different types of estrogen. Yes, there are multiple types. I promise you, you're not the only one. If you do not realize that, I had no idea until I went back to school. But we will be diving into that and I will fill you in on all the gaps. We'll be discussing the importance of estrogen, what happens when there are imbalances, and how to rebalance them. Okay, so as I said, three types of estrogen. There is estrone, E1, estradiol, E3, and estrone, E1, estradiol, E2, and estriol, E3. So those three types, I will repeat those a million times and you will definitely be familiar and understand them as we go along. But all three of those estrogens are predominantly produced in your ovaries as well as a small portion in your adrenals. So, in your ovaries, we bring in a few different ingredients to produce the estrogen. So, in your hypothalamus, which is located in your brain, there is and I will always say this so wrong, the gonadotropin releasing hormone or GnRH. That's coming from your hypothalamus. And then there is the follicle stimulating hormone, FSH, and the luteinizing hormone, LH, coming from your pituitary gland. They form together or they come together to create estrogen. Now, in the adrenals, cholesterol and DHEA come together. So the DHEA is actually produced in the adrenals. Cholesterol and DHEA come together, and that is what's going to form estrogen. Prior to forming estrogen, though, it also produces progesterone and then androgens, which is testosterone, before finally turning into estrogen in all three types: estrone, estradiol, and estriol. If you want more information on this, I'm going to link a video here. It's about 9 minutes long and it gives you drawings and all the beautiful little symbols to really kind of deep dive into how estrogen is truly produced. But for now, I want you to know it is produced both in the ovaries and the adrenal glands, and there are three types. Now, what is estrogen? Why is estrogen important for our health? Whew, there's so many reasons. So, of course, reproductive health, but also bone health. So, a lot of women, especially postmenopause, deal with osteoporosis or osteopenia, which is a decrease in bone density, which puts them at risk of fractures. So, estrogen plays a huge role in this. And then brain function, cognitive function, skin, hair, and nails, breast health, and cardiovascular health, which I think gets everybody. So, for cardiovascular health, it's really interesting. We talked a little bit about cholesterol in the last slide, but it helps maintain healthy levels of cholesterol by increasing HDL, which is our good cholesterol, and decreasing LDL, which is our bad cholesterol. It also improves blood vessel function and prevents clotting. So, as we continue on, again, E1, E2, E3 are going to be very important to discuss. I want you to think about E1 as the least desirable estrogen. We still need it, just like we still need both HDL and LDL, just one is good, one is bad. Estrone is, or E1, is just less desirable. We don't want it to be super high. We want it to stay nice and leveled out. Then estradiol, E2, is our balancing estrogen. It keeps E1 and E3 in check. And then E3 is our good cholesterol. It's the most desirable. We want this one to be higher. This is what's going to help and promote a healthy environment for pregnancy. It's going to help you get pregnant, and it helps keep inflammation down in the body. So as we continue on, these three are going to be discussed significantly as we think about imbalances. So, estrogen imbalances stem from various sources. It can be hormone replacement, it can be from birth control, stress is a huge one, obesity, because estrogen, especially E1, actually feeds off fat cells. It can be issues with diet, medications, medical conditions like PCOS and thyroid disorder. So, there's a lot of lifestyle, environmental, genetic factors that all come into play when it comes to imbalances in estrogen. So, some of the symptoms that you might see with imbalances in estrogen are listed here, and I'll kind of go over them in just a moment. But I want you to remember that although these symptoms are so common, and when you talk to your friends, your family members, your aunts, your cousins, your mom, a lot of these are so common because you're going to talk about them and you're like, oh yeah, I have that and I have that. But the thing is they're not normal. Yes, they're common. Yes, 100% they're common. And now with more research and more women like myself really emphasizing and focusing on women's health, we're realizing just how common they are, but also that they're not normal and that there are ways to fix them, prevent them, heal from them. So, some of the symptoms, the most common symptoms you might find when estrogen is either too high or too low are mood swings, irritability, anxiety, weight gain, especially around the hips, thighs, and stomach, water retention and bloating, irregular, absent, or heavy menstrual periods, fibrotic breasts, lumpy or painful, and headaches or migraines. Migraines is a huge one, and I feel like so many women suffer from migraines. And it explains why they're so much more common in women than in males. And then fatigue, like low energy, depleted fatigue, like you are just flat out exhausted. Changes in libido or sexual function, hot flashes. Again, not normal, common but not normal. Brain fog, low cognitive function, PMDD, the endometriosis or worsening endometriosis symptoms, fibroids, non-cancerous growths in the uterus, or cysts like PCOS, and then also increased risks of breast cancer, uterine cancer, ovarian cancer, and any type of inflammatory diseases like RA, rheumatoid arthritis, MS, muscular sclerosis, or multiple sclerosis, IBS, Crohn's disease, anything like that can be caused by um, issues with estrogen. So, let's talk about rebalancing, which is going to take a lot of lifestyle changes, but nothing crazy. Nothing crazy. I promise you on that. So, the first thing I always say is test, don't guess. Okay. Let's test it. Let's see what's actually happening. This can be challenging when you go to your PCP or OBGYN or specialist. Oftentimes, they might not want to test because they don't see a need for it if you seem to be healthy. Again, the idea behind these symptoms are still so like, oh, they're common, you'll be fine, kind of deal with it. If you're having hot flashes, wear light clothes and have a fan on you. Things like that. Like they just kind of want to put a band aid over it. Sometimes they will test, but it's going to be limited testing. They might test E2 estrogen, which does not show much. That is just our balancing estrogen. We do need to see both E1 and E3 as well. They might test your thyroid, which is super linked to estrogen. They might test a progesterone, maybe a testosterone, TSH, DHEA, but it's usually never a comprehensive hormone test where everything is just laid out, which you will see in just a moment here. So what we want to see is a comprehensive test, everything from all three estrogens, E1, E2, E3, progesterone, testosterone, DHEA, as well as your cortisol levels. So we will talk about cortisol in another part of the series, but cortisol is super important. And again, that's indicating our adrenal function, which if you remember, Part of our estrogen hormones are produced in our adrenals. So we need that functioning properly as well. Then exercise and healthy diet. Exercise and healthy diet make a huge impact on keeping your hormones balanced and helping rebalance them. So, exercise, especially to help with cardiovascular health, to help reduce fat in the body because estrogen likes to feed off fat. Healthy diet, anti inflammatory. We want to try to reduce alcohol, sugars, caffeines, really promote whole foods, whole grains, lots of veggies, lots of fruits, lean meats, and omega 3 fatty acids from seafood. Stress management. This is probably the most important, if not at least one of the most important aspects. Stress plays such a huge role on our adrenal function, inflammatory system in our body. We need to manage our stress. And this looks like yoga, breath work, meditation, getting enough sleep, getting enough time of self-care. And I know speaking to my moms out there, this is so challenging, but it is a priority. It is a huge priority. And then supplementation. So this might look like adding in omega-3s. It might look like adding in DIM, adaptogens for adrenal function. And it might even look like adding in bioidentical hormones to help rebalance those hormones that have been kind of out of sync for so long. So those are some of the lifestyle changes that we can make to improve your overall health and to help start rebalancing your hormones. But the most important part is, again, that test, don't guess. So this is a sample of the testing. Above here is actually my tests when I did my adrenal function and my comprehensive sex hormones. So you can see there is a lot of blue arrows pointing down. That means it's a low. The yellow is showing things that are borderline low, and then red is showing very high. So I was displaying a estrogen dominant profile, which is super, super common, and also showing a completely fatigued adrenal function. So what was happening is that in the adrenal function, if we start there first, my cortisol was bare minimum in the morning. So when I thought I was being lazy, not being able to get off or out of bed, or just feeling like I was dragging myself, it's because I literally did not have enough cortisol in my body to even get me up. So cortisol is one of our main stress hormones. It is also in charge of our sleep-wake cycle. So your cortisol should be between that 14 and 25 range, and it should be starting to move up throughout the day. So when you wake up in the morning, it should be heading up, 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 up to wake you up, make sure you feel energized. And then come noon time, it should continue to go up and then start to kind of come down just a little bit as you go into the evening. So that noon time, that 1, 2, 3 o'clock, I was just kind of nosediving again. I was exhausted. I'd kind of like perk up a little bit and then be exhausted throughout the middle of the day. And then at night, again, I was just kind of on the same path going down. It would spike up just a tiny bit for me at night, which was probably the reason I could not get to sleep very well. I've always had difficulty sleeping or getting to sleep. Once I was asleep, I could stay asleep, but I would still wake up restless and exhausted. So, right here was showing that I was definitely in adrenal fatigue and I need a little boost. And then my DHEA. My DHEA was in the normal range, but on the very, very low end. So you can see reference range is 106 to 300. DHEA, if you remember from one of the first slides, comes together with cholesterol to form estrogen, progesterone, and testosterone. So we need a very happy DHEA to help perform. And especially if any of those numbers, progesterone, estrogen, are low, we need even more DHEA. So my DHEA was low for where I was with all of my comprehensive sex hormones. Let's bring it down there. So E1, if you remember, I said E1 is our least desirable hormone. That is the one that can promote fat storage, inflammation in the body, put us at a higher risk for inflammatory diseases and cancers. So my E1 was high, too high. My E2, my balancing hormone, was within the normal range, but on the low end. And my E3, my poor little E3, which is the most desirable, we want this to be the highest, is when it shows less than 5, it means trace, like non-existent. They couldn't test it, they couldn't find it. So my E3 was like non-existent, which explains when I'd gone off birth control about a year and a half ago, I stopped getting my period. My period was no go. This also makes it very challenging to get pregnant. You're not heading into a normal luteal phase. So not a good place to be. Okay, and then if you look, there is a ratio that is also low. We want that to be well above 1. It was at a 0.14, one of the lowest I have seen on anyone's charts. My progesterone was low. Again, that is not going to put anyone in a good position for pregnancy. And then my testosterone was also low. So all in all, I was really struggling. I was dealing with um, increased fat storage, and I couldn't figure out, no matter what I did, could not lose the weight, could not put on muscle mass, which I had always been so used to. I was always very lean. But again, my testosterone was low. Um, my immune system was kind of stinky. When your testosterone's low, your immune system's not great. I was having flares, like joint pain flares, um, multiple times a month, which had started out maybe like a couple times a year and then maybe once a month. And then it was happening multiple times a month where every joint in my body would flare up and be in pain. It might last a day, it might last 2, 3, 4 days. Couldn't figure out what it was. My PCP, my OBGYN could not figure it out. I had asked for testing. They said it wasn't going to help. But little did I know, it's because my estrone, my E1 was so high that my body was just in a state of inflammation. So, thankfully, since being on my protocol, I've not had a single one of those flare ups. My energy is so much better, and I was able to lose 8 pounds, predominantly of body fat, and have finally been able to start putting on muscle. I have more energy. My cognition is so much better, no more brain fog. With that said, I started this process almost 2 years ago, focusing on my nutrition, my fitness patterns, my self-care and my stress management. And then I added in the comprehensive hormone testing and protocols. So it was a long process. It was a long process, but one that was completely worth it, especially for where I'm at now. And the best part is I understand what I need to do to maintain this. And if anything happens, my plan is to retest every year. So if I do see anything change, I can kind of nip it in the butt and figure it out firsthand and right away. So that's a little insight on the testing and why it's important. I Without this, I would have had no idea kind of where I was and how to treat it. And by knowing, I was able to get most of my symptoms under control within 3 to 4 months, which is huge, huge. And then you can see a GI map digestive function test as well. Now, this one, GI test, this is only showing a tiny portion of it. It's a few pages, but we do GI because most of our hormone transmitters are where our hormones kind of come together and actually come to produce the hormone is in our GI tract. So we need our GI tract to be in prime health so that our hormones can be produced and metabolized correctly. With the GI function, if we're dealing with any type of bloating, any type of issues with increased gas, with GERD or acid reflux, there's something wrong. Again, that is your stomach telling you that there is something wrong with the GI function. So we need to pay attention to that. Again, very common, not normal. When the GI system is when it's inflamed or when there's any inflammation throughout it, it makes it very difficult for hormones again to be produced, to be metabolized. So we need the GI function to be under control before we even hit the hormone health and rebalancing. This is not necessary for everybody. But again, a lot of individuals do need to see what's going on with their GI before we jump into hormone health. So that's kind of like a little bit of insight on testing, why it's important, why we need it, and how it can be beneficial. So moving forward, the biggest part here, the one part I want to drive home is listening to your body signals. So if we look at the symptom page again, one more time. These symptoms, super, super common. I know you've talked to all your girlfriends, your aunts, your cousins, your mom about these, and they're like, yeah, that's normal. Like, I've had it. Not normal. Not normal. All right. So these are common symptoms. Symptoms. That means that it's telling you there's something wrong. All right. There's no reason we should have symptoms unless there is something wrong in our body. So the biggest part that I want to drive home is listening to those cues, those signals telling you that there is something going on and we need to address these health issues. With this knowledge and these tools available, I want you to be able to work towards rebalancing your body. Yes, it can help by working with somebody, and 100%, again, test, don't guess. This process can take anywhere between 6 to 18 months. It is not a process that you are going to rush. It is not a 30-day feel better, 30-day cleanse. It's none of those things. It is a process. And I promise you, though, even though this is a long process, you will feel better. You will be able to achieve a better, healthy version of yourself, and you'll be living the most vibrant version of your life because your body's in homeostasis. Your body is where it wants to be. So the most important part here, listen to your body, get tested, don't play the guessing game, and be patient. Be patient with yourself, be patient with your body, and just remember that you do have the tools, you do have the knowledge, and feel empowered to advocate for yourself and your health. So once again, I'm Dr. Keeleen Mulvihill. I am so excited to be continuing this process with you, and I look forward to joining you with the next part in the Female Autonomy series. Thank you.